So I like to demonstrate the new all-inside FiberStitch with some different variations. The normal FiberStitch is a 12-degree upswept at the tip. So we deliver through our cannula here. This is a straight, which can be helpful in certain situations depending on the morphology of the condyle, where you want to go. If you want to go back toward the root, this gives you a good angle to do so. And you can also use this effectively, for me, coming from the from medial tear from the lateral side toward the mid portion. Say if you have a bucket handle tear, and to get that reduction toward the anterior horn, you can see how this opens up for me coming more anteriorly, having the straight configuration. So usual pass, I like to go usually to 18. You can set your depth gauge here if you're not going to go out the skin. You're just popping through the capsule. So FiberStitch, pull back, roll it forward. So now your first knot's deployed behind the capsule. So then you pick your second point. And again, if it was a bucket, I'm going to go vertical. So I'm going to come up here vertically. So I'm doing a vertical mattress. So again, I'm going to set my depth gauge at 18 right there. Pop through, roll the wheel back, and back forward. That deploys the second anchor behind the capsule. So then we take a probe and pass it through our loop right here. If you watch the screen of your tear, what we're doing is just bringing across that horizontal spanning component of the FiberStitch. And once that's down, you start to feel the other end slide. You take out your probe from the loop and take your free end, and this completes your knot. So you can see I got a nice vertical mattress. So you can see I'm pulling on that, really get a very secure knot. So I've loaded the suture cutter with the suture, and most of the time I've done my reduction already, but you could fine-tune things. If you wanted to pull just a bit more, you can put the knot cutter right on the knot, and you can see we're pulling just a little bit more, and then you just cut your sutures. So there you've got a very low profile knot, vertical mattress. The advantage of that straight FiberStitch for me is going to be coming across more toward the anterior horn area. Also would be useful, say, for a radial tear, where you could pass on each side of the radial tear and get a spanning suture like I do typically with a knee scorpion. And tie a knot, you could also do it knotless with the FiberStitch straight. So I think that's going to be a really beneficial angle to have with the FiberStitch armamentarium. So another very helpful new FiberStitch orientation is the 24-degree up curve, as demonstrated here. So come in through our portal skid. And this is really helpful to get around. Sometimes that femoral condyle can really get in your way. See here we have a nice orientation to be able to pass through the posterior horn of the medial meniscus unencumbered by the condyle. So we're going to put the FiberStitch in position. Pass. I usually go to a depth of 18 here. So I drop it down to the meniscus. I'm at 18. Turn the wheel back and then forward to deploy the first implant behind the capsule. And then we'll come and place our second one here. You could do a vertical, you could do a horizontal. We'll go ahead and do a vertical here. And again, the advantage of the 24 degrees, it's really easy to get up on top of that meniscus. So this will be for a vertical mattress repair. Set the depth at 18, drop it down, wheel back, wheel forward. That deploys the second implant, like so. Here, you've got your outer loop, and you take your probe, pass it through the outer loop, and I like to watch the reduction of that horizontal component of the knot. You see it tightening right there. So once that's down, now I take my free end, and I generally go ahead and do most of my tensioning this way, just pulling the suture. There comes the knot. You can see a very secure repair. As I pull that down, you can see me tightening that up nicely. And the nice thing about the FiberStitch, it's all one-handed, so it's very easy to do by yourself. So now I've loaded the suture in the suture cutter. I just bring that down on top of my knot. Again, I could tension a little bit more if I wanted to there, but that looks pretty secure. So we just cut it short. Again, you can see the condyle's preserved. I haven't hit the condyle, so that 24-degree curve up I think is going to be very helpful for those posterior horn medial meniscal tears to avoid the medial femoral condyle. This is the third variation of the new FiberStitch family. Again, the regular FiberStitch is 12-degree up. I showed you already use of the straight FiberStitch and the 24-degree up FiberStitch. This is a 12-degree down FiberStitch. And this is really helpful for bigger tears, especially bucket handle tears, to lay the meniscus down by passing sutures underneath the meniscus. So very important to have this one in our armamentarium as well. So we're going to pass here into our portal with a vertical mattress posteriorly, sometimes the posterior one will lift up a little bit. So now you come underneath the meniscus and grab underneath with the down swipe here of the 12 degree, and you pass your FiberStitch the same way. Again, I tend to go to the 18th depth, wheel back, wheel forward as we've shown, deploys the first implant. This really helps lay the meniscus down on the tibia. So then we'll make our second pass, and this one is always going to be a horizontal mattress configuration in the underneath aspect of the meniscus. So here's our second pass, wheel back, wheel forward. Again, probe in the loop to seat that horizontal component of our knot here, right there. Once that's down, and then complete the knot by pulling on the free end of the suture. You can see that's laying that meniscus down underneath. So I think this is really an important device to have available to give the versatility to place sutures underneath the meniscus. So we load our suture in the suture cutter, and this one again is obviously underneath the meniscus. So that lays that down very nicely. So we've showed the straight coming from the lateral side. We've showed the 24 degree up and then the 12 degree down to complete this repair.